One of them would be farm workers. After all, you can't grow strawberries in your front yard. You actually have to go out. Usually, farm workers go out in packed buses. They work shoulder to shoulder in these large crews, these cuadrillas. They work in the packing houses. They work shoulder to shoulder. They are rarely offered health insurance. Latinos, even after Obamacare, are twice as likely not to have health insurance. And of course, as we get to places like farm workers, who are largely Latino, almost 100% immigrant, and probably 60 to 80% undocumented, depending upon the crop and the region, left out of the Affordable Care Act and other sorts of things. So when the pandemic finally broke loose, essential workers were protected. We thought everybody else could work from home. Farm workers still had to go out every single day. In fact, they were essential workers. They were given letters by the county saying this person can travel because this person is an essential worker. And the state of California told the Spanish speaking community early on, if you've got symptoms, if you have a fever, if you've got a scratchy throat, hable con su médico pronto. Well, here you have farm workers who don't have health insurance. So if I call a doctor, how am I going to pay for this? That's a lot of money. And secondly, by the way, we have this Latino physician shortage. I don't even know any doctor, much less one that speaks Spanish. I have low income. How am I going to pay it? And if you remember the first 2 months of the pandemic, you need to have a physician's recommendation to just to get the test. And there's, as you know, in healthcare, there's a whole jigsaw puzzle of who pays for what. If you were not covered, you could wind up paying anywhere from $100 to $2,000 for one test. Farm worker family of 6, 7 people, $100 each. That adds up pretty quickly. Then, of course, as a result of this, other essential workers, not only farm workers, but packing house workers, meat packers, truck drivers, gardeners, food industry workers, shelf stockers, grocery store checkout clerks. Imagine the grocery store checkout clerk will have about 300 people pass within an arm's length during a given shift. And for the first couple of months, they were not even offered personal protective equipment. So these folks that were working to make sure the rest of us could eat were far more exposed to coronavirus than those who were able to stay at home. Now, if you remember the first month or so of the shutdown when people were fighting in grocery stores over paper towels and toilet paper, well, if it weren't for these farm workers and truck drivers and packing house workers, etc., exposing themselves to coronavirus, we would have been fighting over the last sack of tomatoes in the store. That would have been some very serious fighting. So, moving forward now, because many populations of color tend to work in these occupations and industries that expose them far more to the coronavirus with less access to care for testing, for treatment, for follow up. Not surprisingly, Latinos have now one of the highest rates of exposure and of mortality in the state of California. So, finally, after being exposed, a Latino, particularly a farm worker, comes into the ER with an advanced case. We had the case of the president of this country just a couple weeks ago suddenly show up, airlifted to an ER. That airlift, by the way, if you're paying out of pocket, was about $60,000. Got some extraordinary courses of treatment of things that just now, 2 weeks later, are being approved by FDA just to use. So he got access. It wasn't a clinical trial, because if it were a clinical trial, there's a 50% chance he didn't get remdesivir. Just looking at the cost of the course of treatment of the remdesivir, not the physician charge, not the hospital room charge, not the airlift charge, just that 6 course of treatment is $3,120. Now, as we look at your average farm worker from a study done by UC Davis, your average farm worker household income is $1,500. So that course of treatment that President Trump got at taxpayer expense would have been 2 months' salary for an average farm worker, because they usually don't have insurance because they're usually undocumented. So that farm worker's household, to pay for that, just that one item, would basically have to forego all food, all housing, all clothing, all transportation for 2 months. Well, if you go without food, your average person dies in about 40 days. That is what we have. As we look at Latino households, they tend to be lower income, but at about $5,441 average income nationally. Usually they might have some access to health care. So for them, the remdesivir costs were only about 60% of their income. And of course, all non-Hispanic white households at $7,000, the remdesivir cost would be about 40% of your monthly income. Clearly, these treatments are very expensive, and with our patchwork of insurance, pricing, costing, and everything else, the ones who have done the most to keep this economy going, the farm workers who have kept us fed. Yes, we complain we don't have the same large variety we used to, but the shelves are not bare, are paying for this literally with their families' lives. Of what our president got for free, and you could add in the other $100,000 in hospital, physician, and air transport cost, simply is beyond the reach of your farm worker family that is feeding us every day. COVID is going to be with us for a while. We're going to have at least one more surge this winter, and if the Supreme Court, now that it now has its new member, takes this up, and if they decide to withdraw Obamacare, that's going to put us back to the days when we had over 55 million people without insurance. We got it down to about 20 million, but that's going to go back up to 50 million, possibly even more, right in the midst of a pandemic. It is a recipe for disaster.